Shall we get started? So thank you and welcome everybody. Welcome to those in the back. Thanks all for being here. Nice to meet you all. Let me start off by saying we're on the traditional territory of Fort William First Nations, and I want to thank Elevate Northwest for this event. And before passing you on to the minister, I'm going to go off topic for just 2 minutes because we're talking about HIV/AIDS here. So because I've kind of lived my life, I've seen this whole story from beginning to we're getting hopefully closer to the end. But I remember as a medical student in 1982 at University of Toronto, going over to Hart House. And Hart House, there was a bulletin board. There was a one-page thing that talked about this unusual outbreak of pneumonias among young gay men in San Francisco. And I looked at it and I thought, is this real? Because I was in medical school. I'd never heard of this. And that was before it got a name, which was AIDS. 3 years later, graduating as a clerk and an intern, there was a significant population in places like Toronto General, young gay men with pneumocystis pneumonia. There was no treatment. People were dying. 1989, I went to Swaziland. I started working there. 88, 1,000 sugarcane workers, 0 HIV. Before I left after 2 years, the incidents, I was checking people with STDs, sexually transmitted diseases. I was getting 10 to 15% of them were coming back HIV positive. Within 4 years of leaving there, 40% of the population had HIV/AIDS. Again, then no treatment. Fast forward to now, a lot of people it's become a chronic disease. This was the previous pandemic. I mean, we talk a lot about COVID, but this was a different kind of pandemic, a slow-moving pandemic, and a pandemic that's still here. With that, let me introduce now our Minister of Health, Monsieur Jean-Yves Duclos, who is formerly professor and director of the Department of Economics at Laval University. He's also a well-known researcher. Previously, he, in 2014, was awarded or elevated to the position of the Society of Canada, which I understand is the highest accolade for Canadian researchers. With that, I'll pass on the mic to Minister Duclos.
Thank you. Good morning, everyone. Bonjour, tout le monde. Thank you for inviting me to the beautiful community of Thunder Bay. Thank you, Marcus, in particular, for being such a strong and reliable supporter of Thunder Bay, Rainy River, both when you are in Ottawa. I see it's difficult to escape Marcus in Ottawa because he seems to be everywhere, including very close to me in the House of Commons. So he also sits on the House of Commons Health Committee. So when a physician of a level of expertise and experience like him sits on a health committee, people listen to him because he comes with a lot of credibility in addition to his engagement. So thank you, Marcus, for doing that. You bring immeasurable expertise to the government of Canada, and your dedication and your commitment to Thunder Bay is really felt and easily felt. Now, my condolences to the family and the friends of the young boy who died yesterday tragically. We obviously think of his family, of his school mates. No, it's a tragedy being a parent and being parents, being fathers in particular. We feel and what level of what that can cause both in the family and in the community and in the school. Thank you also, Holly Gauvin, for inviting us to Elevate NWO. The invitation to come and the warm welcome that you have shared is making an impact on Marcus and I. There is absolutely no doubt that the efforts of you and your team to empower and support people living with HIV or at the risk of living with HIV and hepatitis C, that these efforts are making a very big difference in Thunder Bay and across northwestern Ontario. I would also want to highlight, Holly, that you are also a strong advocate for those that are suffering from the toxic drug crisis that we are seeing here in the community. You call that an emergency, and it is an emergency. It's an emergency that requires the expansion of early interventions, prevention, harm reduction, safe consumption sites, treatment, and also, and perhaps mostly, community support, which, as you do here every day, is adapted to the reality of everyone. It comes from supporting the health and the healthcare outcomes that people need, but also comes from all sorts of other community support services that you provide with the leadership and the partnership of other organizations in a stigma-free access philosophy, looking at individuals as opposed to the conditions in which they may be temporarily found. Now, on a beaucoup cheminé au cours des dernières années dans notre lutte contre le VIH et le sida, mais nous savons qu'il y a encore beaucoup à faire, beaucoup de travail à faire afin de mettre fin à l'épidémie de sida et de VIH, comme Marcus l'a très bien indiqué. Mais nous savons aussi que nous devons et que nous pouvons faire les choses différemment. Et à cet égard, le Premier ministre Trudeau, le 7 février dernier, a annoncé que nous allions faire les choses différemment pour travailler ensemble entre les provinces, les territoires et le gouvernement fédéral pour améliorer les soins de santé pour tous les Canadiens. C'est un plan qui prévoit des investissements d'environ 200 milliards de dollars additionnels au cours des 10 prochaines années afin d'améliorer les soins de santé d'un bout à l'autre du pays. These additional $200 billion announced by the Prime Minister on February the 7th, this is a plan to work with provinces and territories, a collaborative plan, which is rooted in 4 shared health priorities. The first one is family health services, family health teams. Our healthcare system is a strong system when people have access to it. And a cornerstone of equitable access to healthcare is through family and community care. The second thing is to recognize that our health workers have suffered tremendously during COVID-19. We need to do better in terms of supporting them, retaining them, and obviously recruiting and training more of them, as well as recognizing the credentials of those that may have been trained outside of this province or internationally, because we know that there will be, and there are health workers trained in other parts of the world that would like to come and live and work and grow in this particular community. The third piece is mental health and addiction and substance use support. We have a mental health crisis in Canada, in this community in particular. We first need to acknowledge it and to use the tools that we know work to address that mental health crisis. And the fourth thing is to use data in a better way, to share data across partners so that people are looked at more quickly and more safely when they have issues. Now, the goal is to have a patient-centered model where all patients can have access to their medical data, and equally importantly, where all health workers also have easy and quick access to the data that they sometimes need to save lives in order, for instance, to avoid duplicative tests and procedures that we sometimes need to have if our health workers can't share data together. Now, that is leading to today's announcement, because it's all about greater and more equitable access to family and community care, which again are the cornerstone of a properly and well-functioning health care system. And that is why the government of Canada is investing close to $100 million every year to fight against the sexually transmitted and blood-borne infections, and therefore against HIV and AIDS. Ce sont des investissements qui font une grande différence, à la condition que ces investissements soient en appui aux activités des organisations communautaires. This funding supports partners and stakeholders across Canada and globally to end HIV and hepatitis C and other sexually transmitted and blood-borne infections as public health concerns by 2030. Because let us all be clear, Collaboration is key to reach this goal. No one government, and certainly not the federal government, and no single organization can reduce the health impact of sexually transmitted and blood-borne infections alone. Now, in Ontario this year alone, over $30 million will be invested through the HIV and hepatitis C Community Action Fund and the Harm Reduction Fund for a total of 37 projects. This funding will support organizations like Elevate NWO that are on the front line of preventing infections and improving access to HIV and hepatitis C testing, treatment, and care, because those blood-borne and sexually transmitted infections are often preventable, certainly treatable, and sometimes curable. For example, our host today will receive $2.6 million in funding to implement their project called Strengthening Peer Engagement for Northern Ontario. This project, which is going to be led by Elevate NWO, the Gilbert Center for Social and Support Services, the AIDS community of North Bay and area, the Réseau Access Network, and the Ontario Aboriginal HIV/AIDS strategy, is going to help those partners build better and greater capacity to provide peer-to-peer frontline delivery. And I invite everyone to listen carefully to what Holly will say about the value, the great wonders of peer-to-peer support, but also to build better outreach and interventions while fostering accessible, sustainable, and stigma-free prevention, treatment, and support across Northern Ontario. En conclusion, grâce à la prévention, à l'éducation, à la sensibilisation, aux soins et au soutien que vous fournissez à tous les jours, Holly et toute l'équipe, vous faites une réelle différence dans la vie de beaucoup de personnes. Des organisations comme les vôtres sont en effet essentielles pour toute la communauté et des projets comme les vôtres nous rapprochent de cet objectif essentiel d'éradiquer le VIH, l'hépatite C et d'autres infections sexuellement transmissibles d'ici 2030 à l'échelle mondiale. So thank you again, Holly. Thank you for your leadership and partnership that will continue to help save, protect, and change the lives of so many people in the community. Merci beaucoup.
Thank you, Minister. Now I'd like to invite Holly Gauvin, who's the Executive Director of NWO, Elevate NWO. I got it right.
Thank you, Minister Powlowski, and thank you, Minister Duclos. I'm very, very grateful for you making the very long trip up here to Thunder Bay and to Elevate NWO. So I just want to share with the people who are perhaps online. We're standing in a very special space, which is our drop-in center, the Mamatawagming drop-in center. And this is a joint effort between us and our sister organization at the Ontario Aboriginal HIV/AIDS strategy. I want to particularly acknowledge Megan Young, the executive director of that organization. It was her work that led to us being able to open up this center during COVID and provide a really important space for people to gather each day. And through our friends at the Thunder Bay Indigenous Friendship Center, we were able to keep this initiative going. And then our friends at the District Social Service Administrative Board saw the value in it in reaching people who are homeless or people who were spending most of their days on the street and giving them an alternative place to come. So this has become a health hub for us. This has become a place where we come together to work together. This has become a place where we receive health care, where we feast, where we grieve, but always we share. And so we're super honored to share space with you both today in making this funding announcement. And so very, very grateful to you and to all of those who are here to listen to us today. So one of the things that we love to share here at Elevate is knowledge. And one of the things that we always like to acknowledge is that all of us have knowledge. And so in the context of this program, this peer-based program, we have a great opportunity as organizations to bring people together and to talk about how we reduce harms and how we reduce risks related to HIV, hepatitis C, overdose, toxic drug supply, and many of the other issues that face all of our communities. And so this is an evidence-based project based on 2 different research projects that our organizations partnered on. One of them, the Strengthening Connections project, and the other one, Hidden and Hard to Reach Population. In those research projects, it was identified that people who are living with or at risk of HIV, Hep C, overdose, or other harms related to our scope of practice prefer to get their information from peers and from family. And who better to intervene and to provide you with that education and that support when you need it the most than family, than friends, and then loved ones. So our project seeks to put that education and that information into the hands of people who have lived experience and people who love people who have lived experience, and to make sure that they have the skills, the knowledge, the resources, and the assets of the whole organization to bring that information forward to people who might be at risk and to prevent the spread of infectious disease, to end overdose related deaths, and to help people identify safer supply options. And so that's our project. I want to acknowledge my colleagues at the AIDS Committee of North Bay and area, our friends at Rizzo Access Network in Sudbury, our friends at the Gilbert Center in Barrie, and of course, our partners at the Ontario Aboriginal HIV/AIDS Strategy, who are also have an office co-located with us. And so we're honored to share space with you today and honored to share this announcement. And so thank you again so much for being here with us today. Miigwech.
Thank you. I think that's the concluding remarks. However, I'll ask Guillaume to come forward and he's going to entertain some questions possibly from the media. Nous pouvons prendre les questions en français aussi. Le ministre peut répondre en français et moi, probablement non.
Thank you. Can we open the mic? It's open? Okay, cool. Indeed, you can ask your question in your preferred official language. So we'll start with a question on the floor. Please come to the mic to ask your question. I ask to limit to 1 question, 1 follow-up, and then we'll move online for the people that are watching through Zoom.
Bonjour, Céline Marty, Radio-Canada. Je sais que vous étiez à Sudbury hier. Vous êtes donc à Thunder Bay pour cette annonce aujourd'hui. Est-ce que c'est un problème qui est plus récurrent dans le nord-ouest de l'Ontario?
Bien, je vais répondre. Marcus, tu pourras peut-être ajouter avec le français qu'on t'a gentiment aidé à apprendre dans la communauté. Il y a plusieurs choses qui font que la communauté du nord d'Ontario est différente des communautés plus au sud et plus urbaines. La première, c'est qu'évidemment, les distances sont beaucoup plus importantes. Les services de santé sont donc plus difficiles et plus coûteux à offrir, y compris les services de santé communautaires. La deuxième chose, c'est que les besoins sont aussi plus importants. En fait, en raison du fait que l'accès à la médecine familiale, l'accès à la santé communautaire, c'est plus difficile. Les gens attendent souvent plus longtemps avant de recevoir les soins dont ils ont besoin. Et attendant plus longtemps, ça fait en sorte que leurs conditions de santé se détériorent et que c'est plus coûteux et plus difficile de pouvoir les traiter. Mais la troisième chose, c'est qu'on va se le dire très clairement, la communauté ici, dans le nord d'Ontario, souffre de la crise des drogues toxiques de manière évidente. Évidemment, le traumatisme intergénérationnel et le colonialisme qu'ont vécu les peuples autochtones des Premières Nations dans la région exacerbe encore davantage cette crise des drogues toxiques et de santé mentale aiguë. Et ça fait en sorte que la communauté des acteurs, des travailleurs, des organisations communautaires portent un fardeau plus lourd que celui qu'on retrouve dans beaucoup d'autres régions en Ontario et ailleurs au pays. Donc oui, la situation est différente. En plus, étant plus loin des endroits où les décisions politiques se prennent, c'est plus difficile pour les gens de la région de faire valoir politiquement l'importance d'investir dans la communauté. C'est plus difficile parce que Ottawa et Toronto, c'est plus loin et que politiquement, donc, c'est plus difficile pour les gens ou les gens qui prennent des décisions de prendre des décisions basées sur la réalité, la connaissance réelle de la situation ici dans le nord de l'Ontario.
Puis je voulais juste savoir, est-ce qu'il y aura une certaine évaluation qui sera faite de ces programmes à savoir s'ils fonctionnent bien?
Okay. Est-ce que vous souhaitez une réponse en anglais ou en français? I didn't check whether you understand French, Holly. The question is about whether there is existing data on whether this type of funding works, whether it helps people, and whether there will be, as we invest those funds, whether there will be an opportunity for knowledge on the impact of those funds
To measure
to be measured and to be shared. We'd like to.
So this program has evolved over time. We've had the honor of working with the Public Health Agency of Canada for more than a decade. And this particular project has taken on many shapes and forms over the years. And so year over year, we do an evaluation and that evaluation is rolled up. And so there is data that suggests that these types of peer-based initiatives are effective strategies. We've certainly seen in our own community, and those from the local media that are here can attest to the fact that, you know, we've done a lot of peer-based work here at Elevate, in particular over the last few years working with the homeless population, and we've seen some amazing impacts. And so there is some good evidence. I don't have the statistics in front of me, but I could definitely get you that information.
Okay, thank you, merci.
Next question.
Good morning. I'm wondering if any of this funding around the region could go towards more safe consumption sites within Northwestern Ontario, as Thunder Bay very specifically has quite an intense issue with drugs on the streets and in homes and just people getting very sick. But having safe consumption sites could help with that, especially since there's only one in the region, and that's here in Thunder Bay. Could this funding be used towards that outside of the city specifically?
Well, I'll answer briefly, and then Holly will be able to expand. Everything is connected. You know, the people, the substances, and the community are connected. So when we speak about the toxic drug supply, this obviously has an impact on the health and the lives of people. It has also an impact on the ability for people to be able to access safe and stigma-free health and community support. And it's also connected to forms of support that people also need and deserve, such as housing support, basic support, you know, like how do I get access to education or to training so I can reintegrate the workforce. So it's part of the challenge and the success of an organization like Elevate NWO to connect all of these pieces together and to help people move forward. And that includes the provision, as you said, of safe consumption services. But for that to be perhaps more grounded in what Elevate NWO does, maybe Holly, you'd like to expand?
So the funding that this falls under is very specific to sexually transmitted infections and blood-borne illness. There is a harm reduction fund, which is a separate funding stream that isn't part of this. This is the STBBI funds. And so it is really aimed at reducing sexually transmitted infection, blood-borne illness. But we know here in Northwestern Ontario that infectious diseases are often transmitted through drug use. And so that's why our enhanced focus on harm reduction practices in Northwestern Ontario are so very important, and why, again, that peer-based component, this is how people learn from one another, is such a key element of that. But as Minister Duclos said, the interconnection is there, right? So we work closely with our partners at the supervised consumption site at the Northwest Health Unit and PATH 525. Our peers work with their peers. Our peers connect with peers across the region. And so Northwestern Ontario is actually quite small for being such a vast tract of land. We're quite a small community. And so we always have to work in that interconnected way. But yeah, this money was specifically designated for STBDIs. And the harm reduction fund is probably more to what you might be speaking to about supervised consumption sites.
And then for my follow-up, I'm wondering then, with it being specifically then for the sexually transmitted diseases and such, would then a mobile unit being able to travel the city and travel the region be in the works to help with that?
That's actually what we do. Our services are very mobile. Our nurses are actually going out to do outreach today and to do intakes on people who've been newly diagnosed. We also do portable testing in partnership with the Thunder Bay District Health Unit, in partnership with the Northwest Health Unit out in the region, as well as in partnership with the North. With the local CHC, so with Norwest, sorry, the name escaped me for a second. So yes, so we do mobile work. Could we do more? Absolutely. There is a need for more mobile services and more resources. And so we're seeking at the local level, the provincial level, and the federal level to find those resources to purchase a van that would more easily facilitate those types of things. It's been all over the local news for about a year now. And so we'll continue to drill down on that until we're able to deliver on that. But we do mobile services, as do most of the communities that I mentioned in our partner organizations. Most of them are also doing mobile services. The days of people attending appointments in a very structured way are probably long behind us. We serve a population that's not best served by appointment-based practices. And so we need to move with that. And that's that mobile service that you're talking about.
Hi. Thank you. I just wondered a little bit about the scope of this project, which parts of the region it will be covering and where you'll be providing those services.
So this covers Barrie to the Manitoba border, because we actually have a lot of peers in a lot of different communities. Thunder Bay, we've enjoyed a long history of peer work. So we have local peers. Some of them are in the audience today. Some of them are serving in various parts of the organization. But we also have peers all the way out in the region, all the way up to Kenora and Keewatin. And so this work continues to impact all the way out, which is really important right now. As many of you know, we have an HIV outbreak in Thunder Bay. We have an HIV outbreak in Kenora. These types of programs, this type of peer-to-peer learning is essential if we're going to turn that around. It isn't just healthcare providers that need to respond. These are community issues, and we need to involve the entire community in it. And that includes people who are at the greatest risk. They are truly the people on the front line. So it's essential that we're involving them in this.
Thank you. And I know you touched on the importance of these initiatives being led by people with lived experience. What kind of difference does that approach make when serving these people that may be in vulnerable positions?
Again, referencing the work that we've done with the homeless population over the last few years, I know firsthand going with the peers into the camps, everybody's always very grateful to see us when the workers from the organization, happy to receive resources and what supports we're able to offer. But it was the peers that they had private conversations with. It was the peers that they went off to the side with and said, you know, I didn't want to ask. I didn't know if it was too much. I was afraid to say. It's the peers that are the lead in if we're ever to make those inroads into these communities. And so it's essential that they're at the front of it, that they're helping to lead and guide it and to shape it. It also has this amazing impact on the peers' lives as well. The people with lived experience being able to be reflected in the workplace and to be seen as valued, and that they're to not just be told they're valued, but to actually see their ideas go from a concept into actually actionable in the community, and to know and to be recognized that that is making a difference in their community. That's essential to somebody's well-being. We talked about the mental health crisis that we're experiencing here in the North. And a lot of that is the utter futility that people feel. People stop feeling that futility when they're engaged. They stop feeling that futility when they feel like they are part of a solution and not just victims to the problems that exist in our community. And so thank you for that question.
Thank you.
Hi, I'm Carl Langdon with TBT News. So funding comes and funding goes. Money has been received in the past for a plethora of issues, but what we haven't seen is the essential policy changes required to really come to solutions for the issues. I'd like to hear your perspective on what policy changes might actually alleviate the issue further down the line, rather than just mitigation strategies. Thank you.
And your question is for?
Holly, thank you.
That's a really big question.
I guess it could be for
And it's
anybody to answer, really.
a great question. I'm looking forward to the answer.
I was kind of hoping you would have that. So, I mean, there's a number of policies, you know, certainly in the context of the work that we're doing around STBBIs, it would be really great to see the roadmap that was recently released from the working group. It would be really great to have that reviewed by various ministerial tables, and to see some actions put behind that. That roadmap is all about Hep C, and it's all about ways that we can get in front of it, because Hep C is growing. We just can't seem to get in front of it. And so I would really love to be able to have some really robust conversations about that. If that leads to policy, if that leads to funding, shifts in practices, I think all of those should be on the table for the conversation. For us here in Northwestern Ontario, though, I keep going back to safer supply, that need for ongoing funding. And the minister and I certainly had a conversation about safer supply. And right now the funding is year to year. And while that's been great, and we've seen some really wonderful work come out of Norwest in partnership with a number of us, it's only 1 year at a time. The funding's only 1 year at a time. So here we take somebody from toxic supply. We have them in this really robust program that provides really life-changing intervention. And then in a year, if that funding isn't there, then we're saying to them, you need to go back to what is potentially life-threatening supply. And so we'd really like to see funding structures that allow for longer periods of time to try these types of initiatives, and to be able to have a longer term strategy with somebody. 1 year, it takes a lifetime for somebody to reach a state of addiction and their bottom. To have it resolved in a year is nearly impossible. And so yeah, we would like to be able to see those types of funding shifts. So those are, I guess, policy, funding, practice shifts. I think there's room for everybody to grow with this. It isn't, again, though, I just want to reiterate, this isn't just a government problem, right? These are all community issues, and that takes the entire community pulling in the same direction if we're ever going to change the course here in Thunder Bay and in all of our communities across Canada.
Well, we say that it's not a government issue, but ultimately we've seen policy for the last century exacerbate the issue rather than really alleviate the issue with respect to enforcement policies. We haven't really seen the success that was intended, right? I mean, we've gone through the war on drugs and seen an increase in use and an increase in deaths.
So my comment wasn't that it isn't a government issue. It absolutely is. It isn't just a government issue, right? But I mean, I think you're talking about drug policy, right? And absolutely, I mean, we are very much a harm reduction organization at our core. So for us, we would love to see parties coming together to talk about creating drug policy that is healthcare focused, non-enforcement focused. So thank you for the lead up to that. I'm very focused on safer supply. We've had a number of overdose related deaths in this organization over the last few years. And so that is a big part of our work and our focus. But I really do appreciate you teasing that out. But I believe Minister Powlowski has something.
Thank you.
Just backbencher Powlowski. So we're here talking about blood-borne diseases, right? And sexually transmitted diseases, but this is very much linked to the problem with drugs, and especially in Canada. And the initial question from Celine had been in Northern Ontario, do we have more of a problem? And the problem with HIV and hepatitis C, especially in Thunder Bay, is very much connected to dirty needles. And the nature of HIV/AIDS is changed over time. So the question of our approach to the drug problem, which I think you're getting at, and unfortunately, and as you know, having worked a lot of years in the emergency room here, I have to say, sadly, we're not doing any better now than we were doing 5 or 10 years ago. We're doing worse. There's more of a problem now than there was before. And certainly a big part of the problem is contaminated drug supply. So a safe drug supply may be important, but that's only a part of the answer, because a lot of the problems with safe drug supply, it's not people that are going out knowingly doing narcotics. They're people doing crack, and the crack is contaminated with fentanyl, and they're dying from fentanyl overdose, not even knowing they're doing narcotics. They think they're doing crack. So the safe drug supply doesn't include like a safe supply of crack. So I think that can be part of the solution, but it's certainly not all of the solution. And we need more money to address the problems with guns and gangs in Thunder Bay. And certainly Minister Mendocino recently announced, I think, $365 million more to go towards that. We're hoping, and I'm promoting, that Thunder Bay gets some of that money, because I think that's part of the equation. Better treatment programs and long-term treatment programs are part of the equation. And I think another big part of the equation is addressing the underlying social problems and poverty, which I think drives a lot of people into drugs to begin with. And that's a matter of improving the economy, which is also part of our job as the governing party.
I'm just going to squat. It got shorter and shorter and shorter. That's okay. This obviously is federal money. Every health initiative, for the most part, requires partnership, was mentioned here today. What sort of partnership is there working with the provincial governments on harm reduction strategies like this? Is there anything in the works? Is there any money coming from the province that the federal government's leaning on, saying, we're doing our part, join us? Is there anything like that coming?
Well, stand ready, Holly. I'll speak to the key word, which is access. Well, earlier we heard a question about what can we do better in 2023 that we couldn't do, say, 10, 20, or certainly 30 or 40 years ago. Something we can do better is the use of better treatments, better therapies, medicines that are now available, were not available in the 1980s when you started your studies, Marcus. We have preventative treatments, we have curative treatments that work, but these work increasingly better, but these work if people have access to them. So access to diagnosis, access to first prevention, then early intervention, then diagnosis. Then if you are diagnosed with HIV, you have access to the drugs that make you have a undetectable load of HIV, which then means that you cannot transmit HIV. So these treatments exist, but the key thing is how can people access those treatments and therapies? So on that, access, as we know, is mostly driven by access to community and family health services. So it's not the federal government that drives most of these investments. It certainly not drives most of these actions on the ground. It's the provincial government that has the jurisdiction and the ability to do that. The good news is that the federal government is going to invest significantly more dollars in the next 10 years than it would have done just a few months ago. So the 200 or the approximately 200 billion additional dollars in making people get better and faster access to family and community care. But on that, I think, again, Holly would be able to speak as to how she and her team are able to connect the funding that we're announcing this morning, which is obviously very important, but it's as we all know, it's a small subset of the total level of efforts that need to be exerted in the community.
So certainly in our case, our primary funder is the Ministry of Health and Long-Term Care, provincial funder. I can speak to the AIDS Bureau and Hepatitis Secretariat branches of the Ministry of Health, and they have a long history of working very closely with the Public Health Agency of Canada and the federal counterparts, and coordinating access, ensuring that there's not a duplication of funding, and that any overlap that might occur is well justified and well understood. So there's definitely within those two branches a lot of good collaboration that happens. And certainly, I mean, I absolutely agree. You know, community-based initiatives and family health is really going to be what helps to move things forward and helps to put an end to the continuation of newly acquired infectious diseases, but also ensures that no one gets left behind. And so people who do receive a diagnosis of HIV will be living with this lifelong, so they shouldn't be left behind. And so these types of initiatives ensure that those types of things don't happen, that people fall through the cracks less and less.
And MP Powlowski kind of touched on this a little earlier. They're discussing the whole dirty needle. I've spoken with many people across Northwestern Ontario, and they say there's an issue with the needle exchange program where it's not like take a penny, leave a penny, where you bring in a needle, you get a clean needle. It's more of handing out the needles, and people are expressing their frustrations and their issues with it as not addressing the problem. From your perspective, and I'm also going to get the government's perspective as well. From your perspective, does that policy still work? And from the federal members here, or government members here, is there a change in policy potentially coming for that, as it's being shown that it's not working to some people at face value?
This conversation comes up quite a lot. So needle exchange programs have been shown ineffective when you use the take a penny, leave a penny approach. What happens is, oh, I don't have a penny to leave, so therefore I can't get a new needle, right? So now I need to use a used needle. So from an infectious disease transmission standpoint, we certainly wouldn't ever support a take a penny, leave a penny approach. I do understand from a community, and I live in Thunder Bay, part of the community cleanup efforts myself. So I understand what people are saying, that it's unsightly and it can be frightening. The vast majority of needles, though, found in Thunder Bay are still in their packaging. Yes, there are used needles out there. I won't deny that, but the majority of them are. So that's actually more of it goes back to actually drug policy, people not wanting to be caught with equipment on them. And so oftentimes they're dropping large bags of it. that doesn't help the community feel any safer. And so I feel like we're at a really good point to have a conversation about how do we manage better disposal efforts. And so we need to have a lot more disposal sites. We need to have a lot more opportunities for people to make it easier for people to dispose of syringes in an appropriate manner. And we also need to reduce the stigma around it. And so, I mean, I've heard the words clean and dirty used to describe needles. It's actually new and used. Right? New and used needles takes the stigma away from it, but helps us identify this has potential risk. This does not, right? And so I think that there's a few different pieces that we need to unpack with that. But certainly from a health perspective, we would never support the take a penny, leave a penny approach. Because it will lead to a rise in infectious diseases. And I feel we have seen evidence of that in the Northwest during COVID, when a lot of programs were on reduced hours, reduced staffing levels, or closed down altogether. People were forced to make alternative decisions around their substance use and may have been put at increased risk as a result of it. So we need to have more options for safe disposal.
Just on the dirty, I know, and especially on like my part of town, but I think this part of town too, there's a lot of concern about used needles in the community. I don't claim to know the answer to that. But I do know, and especially like HIV, the risk is a freshly used needles when it's like a day old or something, that isn't a source of people getting HIV/AIDS. But I'd also like to point out that the devil's always in the detail, and it's a good question you ask. I don't know the answer to that, but I would say having somebody like the minister, the person who makes the policy decisions here, being asked that question and going to the hospital, talking to people on the front line is the right way to actually come to answers, rather than to start from the top to talking to the provincial ministers, the CEOs, the big honchos, because the problems are here at the ground level and the solutions are at the ground level. So I'm really pleased to see the minister coming here and seeing the problems firsthand.
And just to wrap up, the devil is indeed in the details, and the solution is indeed in the community. So when we have Elevate NWO and all of those community leaders that are there to help people on the ground, that's what is making an effective impact in the community. So the federal government, even the provincial governments may have high level guidelines, but at the end, it's how it works on the ground that actually matters.
Thank you. That was a lot of really good questions. So we'll pass it over to the few reporters on the line, and I'll pass it over to you. Thank you.
Merci, Guillaume. We will now proceed to questions from journalists online. If you are a reporter and wish to ask a question, please use the hand raising function. We ask that you limit yourself to one question and one follow-up. Unless I have stated it, please indicate your name and media outlet before asking your question. Nous allons maintenant prendre des questions des journalistes sur le Zoom. Si vous êtes un journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et une question suivie, sauf si je l'ai dit. Veuillez identifier votre nom et votre média avant de poser votre question. Alors, est-ce qu'on a des questions sur Zoom? Any questions? Aucune question de notre côté. De retour à toi, Guillaume.
Okay, thank you. So once again, thanks to Elevate NWO for the great work in your community, and also for hosting us today. This ends the press conference.
Good.